Housing First is a best practice approach to addressing homelessness. Adopted all across the nation, Housing First prioritizes providing permanent housing as quickly as possible, ending that family's episode of homelessness, and thus serving as a platform from which they're able to pursue their personal goals and improve their quality of life. This approach is based on the understanding and belief that people need basic necessities like food and a place to live before they're able to tend to anything less critical, such as getting a job, going back to school, addressing their health concerns, or tending to finances. At Lydia Place, when a family comes through our doors, our first step is always making sure their basic needs are met. We know that each family's needs are unique and based on their own experiences and circumstances, and that housing is the first and most important step in mitigating the traumas that led to and have been caused by their experience of homelessness. Therefore, we've built our programs with this in mind, and so there's no prerequisites to our services beyond income and housing eligibility. Our first and primary goal is always to work with families in order to access permanent housing as quickly as possible, and then from there build a plan with their families centered around their hopes and dreams for their future and their children's future, and identify ways we can come alongside them in order to help them make their dreams a reality. Multiple large-scale and nationwide studies have been conducted over the years, with every single one pointing back to the effectiveness of the Housing First approach and the power of programs that center client voice and autonomy. Study after study continues to demonstrate that clients are more likely to participate in and stay in treatment, mental health, and other healthcare-related services if they are in housing and if such services are not mandated. With the Housing First approach, housing retention also increases, and there are significant cost savings to our communities too. It's estimated that in terms of emergency response services, there's a total cost savings of $31,000 per person housed in a Housing First program within their first 2 years. It's also estimated that Housing First programs cost $23,000 less than shelter programs per client a year as well. The systemic and root causes of homelessness are complex, but at the end of the day, we know that the real solution is to provide safe, affordable, permanent housing, and we're proud to model the Housing First approach in our work.